The first few weeks with baby are all about developing a daily routine that works for you both, but it can take some time to get there. It all starts with learning your little one's cues. Are they sleepy, happy, uncomfortable, satisfied? I'll take you through some examples of what these cues look like. Newborns sleep about 8 to 9 hours a day. Overnight, they sleep about 8 hours in 1 to 2 hour increments. It's uncommon for babies to sleep through the night until about 3 months. While you can't sleep train right now, you're establishing routines and laying the groundwork for good sleep. Sleeping cues look like rubbing eyes, yawning, looking away, or fussing. Your little one's tummy is tiny and they digest easily, so they'll want to be fed often, about 8 to 12 times in 24 hours. It's best to make sure they don't go too long between feedings either, about 3 hours during the day and 4 hours overnight. Do your best to feed your baby on cue, when they're calm and in the early stages of hunger. Early hunger signs: smacking lips, licking lips, or sticking tongue out of mouth, bringing hand to mouth, bringing any objects towards the mouth, toys, clothing, anything nearby, especially if a newborn. You may notice that your little one becomes more worked up and agitated if you miss this stage of hunger. Active signs of hunger include rooting. This is leaning towards what is touching their cheek, looking for a breast or bottle. Trying to get ready to feed by laying back and leaning on your clothes, fidgeting and squirming. Hitting you on your arms or chest repeatedly, breathing fast, or fussing. Late signs of hunger include crying, moving head from side to side, or acting frantic. When your baby is at this stage, they'll definitely do all they can to communicate that they're hungry and that they're not happy about it. Try to calm them down a bit before feeding. You can try what they normally like for comfort. Maybe it's swaddling, shushing, or rocking. Being a baby is frustrating. Babies might get fussy or cry when they're uncomfortable. Here are a few reasons for that discomfort and what you can do. Gas. Swallowing air during feedings can cause discomfort. Try moving their legs around in a circle to see if you can relieve some of that gassiness. They also may need to be burped. Too hot or too cold? Try adjusting their clothing. Needs a diaper change. Colic. Babies with colic will cry for up to 3 hours a day, 3 days a week, for 3 weeks or more. Dealing with colic in a baby can be a major trial for parents. If you met your baby's needs by feeding them, changing their diaper, and more, you can try swaddling, rocking or swaying, shushing, white noise, baby wearing. Some babies just feel great when they're close to their parents. Going for a car ride. Having a baby with colic can be very difficult. Remember that this phase will end, usually around 3 to 4 months. If you can't find a cause for your baby's crying and they're inconsolable, call your pediatrician for advice. Many signs of a happy baby are obvious. They're calm, content, they snuggle into you. As they get older, they begin to smile and respond to things they love, like you. Because babies have limited ways of communicating their needs, understanding your baby's cues will take time. Be gentle on yourself. The more time you spend together, the more you'll learn their cues and how to anticipate their needs. And remember, Ovia is your daily companion to track and learn your baby's habits.